I will be talking about Adderall, but as you can see, there are many other names than it may be called, but for the sake of keeping it simple, I will only be calling the drug Adderall. Adderall is a Schedule II drug, meaning that it has a high potential for dependency, abuse, and addiction, but that it does have a medical purpose of treating ADHD and narcolepsy. While it is relatively commonly known that Adderall can be very addictive, it was first synthesized in 1910 and had unrestricted sales until 1939. It wasn't until the 1950s that Adderall abuse became recognized, and in the 1970s it was demonstrated to be clinically effective in treating ADHD and narcolepsy, but it is more commonly used to treat ADHD. ADHD is caused by a defective gene that causes a decrease in sensitivity to dopamine. This then causes hyperactivity and an inability to focus. As a result, those who have ADHD often rely on medication, such as Adderall, to increase their attentional skills. When taken appropriately, Adderall can decrease hyperactivity and impulsivity while improving performance and attention, as well as reducing stress and combating fatigue. However, there are some side effects, such as anorexia, nausea and vomiting, insomnia, and increased blood pressure and heart rate. However, these symptoms can improve over time as the body adjusts to the medication. Adderall is intended to be taken orally, so it is absorbed in the small intestine and undergoes first-pass metabolism. It only takes about 20 to 30 minutes to absorb, but unfortunately I have not been able to find any information about whether it depot binds or not. Adderall goes through first-order kinetics, so it does have a known half-life of about 9.77 to 11 hours. But this may be altered depending on the ingestion of certain foods or other medications. Specifically, high-fat meals and alkaline substances, such as Tums or other antacids, can reduce Adderall's absorption, along with citrus fruits and vitamin C. While not related to absorption, high levels of caffeine can increase the side effects of Adderall, since caffeine also causes an increase in heart rate. Since Adderall is a water-soluble molecule, it cannot freely diffuse through the cell membrane. Instead, Adderall is transported into the cell via a dopamine transporter, where it influences dopamine release. And as we all know, dopamine is involved in rewarding behaviors. As a result, as Adderall binds to receptors as an indirect agonist, it increases dopamine release, which then increases the likelihood of an individual performing rewarding behaviors. While it may seem counterintuitive for an already hyperactive individual to take a stimulant, Adderall works in a very specific way to allow an increase in focus rather than an increase in general excitability. Because individuals with ADHD must take Adderall long-term, they often show tolerance. This is due to the downregulation of dopamine transporters. After all, as dopamine release increases, it is not necessary to have the same number of receptors. Because of this, people who take Adderall will usually require increased doses to have the same effect over time. As a result of this dependence on Adderall, if an individual stops taking Adderall, they will likely have withdrawal symptoms, which may include prolonged sleep, depressed mood, and overeating, followed by sleep disturbances and lethargy. Since Adderall causes a downregulation of dopamine receptors, if not taken, dopamine that is still being released would have more difficulty binding. This would help to explain the depressed mood. However, Adderall also increases norepinephrine release, so it works to stimulate the sympathetic nervous system. Again, since an individual going through withdrawal would not be taking the medication, they would not have that increased norepinephrine release. With decreased norepinephrine, there would be more parasympathetic influence, which is associated with resting and digesting, and this would explain the lethargy, overeating, and excessive sleeping. For an individual who is going through withdrawal, Adderall would be taking away the negative effects of not taking the drug, thus functioning as a negative reinforcer. Even so, it is still often a challenge for doctors to keep their ADHD patients on Adderall. However, because it is a stimulant, many college-age students are drawn to the drug. Adderall can function as a positive reinforcer in such individuals because it allows them to focus better than when they are not on the drug. With its reinforcing role, Adderall can be highly addictive, which explains why it is a Schedule II drug. Because of its schedule, it is difficult to acquire, with those who take Adderall often being required to do random drug testing to ensure that they are the ones taking the drug rather than distributing it. Adderall has a very strong influence on the reward system because of its role in dopamine release, but it also affects the sympathetic nervous system, which assists in attentional capabilities. Because of these major functions, Adderall can be very addictive, but it is not likely to cause any long-term problems for individuals who take it appropriately.